So looking at the implications of these numbers and the new variants, so you've heard the UK Health Security Agency say that the variant called B11529 has a spike protein that has dramatically different to the one in the original coronavirus that COVID-19 vaccines are based on. It says mutations that are likely to evade the immune response generated both by prior infection and vaccination, and also mutations associated with increased infectivity. The newly identified coronavirus variant that has spread in South Africa is the most concerning that British health officials have yet seen, they say, as it has doubled the number of mutations of the Delta variant, including some associated with evading immune response. To get some insights now, Professor Alex van der Heever, Chair of the Social Security Administration and Management Studies at the University of Witwatersrand in Johannesburg, joins us now. So, Professor, could this announcement place us under scrutiny with other countries? We've heard of the travel advisory or ban that the UK has issued to its citizens.
Yeah, it does put us under a lot of pressure. The question is whether it's justified. South Africa has a very good capability in doing genomic analysis and being able to detect variants very quickly, whereas a lot of other countries are both not bothering to do this or don't have the capability to do it. So it doesn't mean the variants aren't there, it just means they're not looking.
This is what I wanted to ask you, that with the Delta variant, there was a lot of song and dance from Britain, but the variant was there in Britain as well.
It was, and so was the beta variant as well. And there was the so-called Kent variant originally, which came from the UK and then resulted in irrelevant travel bans against the UK. So the issue is that we're going to see variants emerge. This is something that is absolutely expected. It's not a surprise. The question is, when you detect them, what do you do? The fact is that when South Africa detects a variant, it doesn't mean that it originated here. It's quite possible that it originated in the countries which have very high levels of transmission. And there are very high levels of transmission in many countries, all simultaneously at this point, including in Europe and the UK, which has far higher levels of transmission than South Africa. So the likelihood of the development of a variant in the UK, in Germany, in Austria, etc., is very high. So the fact that we detected it here doesn't mean it's not there. So the idea of having a travel ban against South Africa, because on the assumption that because we detected it here, it originated here, is really ridiculous. And I think that this is really the problem, and I think the WHO is absolutely correct that our best protections come from the generalized measures that we are introducing to contain transmission, such as dealing with super spreading events, wearing masks, protecting ourselves, getting vaccinated, and potentially updating vaccines as variants emerge. There's no other strategy, and travel bans can't stop the variants from getting into countries, as was proven right from day one with this virus. It got everywhere. It didn't matter whether or not you closed down the introduced international travel bans. It was still everywhere.
This is what I was going to say, that it would seem from the reports it would be labeled including travelers from South Africa, the assumption meaning that they brought it with them. But let's look at how we've done our modelling. We, as a country, have been saying that we know that there is a fourth wave imminent, and it could also be at the onset of a new variant. So what kind of precautionary measures are taken, bar from trying to speed up on vaccines supply and obviously the dosage of those who are willing to be vaccinated?
Yeah, so I think that in South Africa we've got a relatively sort of lax in the past few months, which kind of typically happens. I think that we really the sort of fourth waves and the expected fourth wave in December was always going to originate around a number of super spreading events, as it occurred last year in December, and it appears as though the sort of December wave tends to coincide with the winter wave in Europe. That's pretty much what happened last year. We've had a different variant for every single wave. And so this is also not unexpected, but it doesn't necessarily mean that the way that the variant is driving the wave. It's just that it is the dominant variant at the time that the super spreading events cause a sort of a substantial and exponential rise in transmission. So I think that we're basically experiencing what we experienced last year. What we really don't know is the extent to which this variant may impact on severe illness, even if you're vaccinated. I think that we will know within about 2 to 3 weeks whether that is an issue. And I would say it is worthwhile people being very, very careful about how they interact during this period, even if they've been double vaccinated and fully vaccinated. It's not worth taking the risk at this point until we know for sure what's going on.
Would another lockdown be a deterrent to bigger numbers of people gathering?
So it depends what kind of lockdown. I think that one can impose a certain set of restrictions, but if those restrictions impact on our economy again, we will be in a different kind of trouble. So we have to learn to live with the virus without shutting down the economy, because it has fundamental effects on our government's capability to continue basically providing overall healthcare and other services, because government revenue goes down when you shut down the economy. We can't afford to go into that position. So right now we have to manage these risks without any kind of economic impact. So it's quite possible that restrictions that limit large gatherings would be appropriate. But the question is, do you extend that to gatherings that impact directly on economic activity? I think we would have to be fairly careful when we start to do that. But it is also possible to protect certain environments that are high risk in terms of gatherings, such as at pubs, bars, etc., without necessarily impacting significantly on the economy. It's about closing times. It's about days of the week that things are open. But I really think we need to avoid any kind of extreme set of so-called lockdowns. But I think we may need to consider certain restrictions on large gatherings and also step up the vaccination campaign, because it's very probable that the current set of vaccines that we have will still work on this particular variant.
In the past, there's been discussions about localized lockdowns, Gauteng having greater restrictions here where you see the variant, and those where they're possibly appearing in other provinces. Would this also be a possible answer?
Well, it could be considered. It's the equivalent of the international travel ban. We're only detecting this particular variant now, but it will have been around for quite some time, which means it's quite probably everywhere, even if it's not necessarily driving a wave anywhere else. So you're not necessarily preventing the variant from getting out. What we could be doing is a lot more of an aggressive test and trace strategy around these, which is often a sort of a surge test and trace, where you attempt to isolate people and quarantine them using a sort of a generalized test and trace strategy. That's not possible if the infection levels rise exponentially and get too large. But where we're dealing with this particular case, it would make sense for us to at least try and isolate the people who have the variant at this point in time, as opposed to those who might have the Delta variant, because there we know the vaccines work. So I think that's the kind of strategy that could be considered. It's still a very difficult one to get to work, and it can be localized. But I think that we're going to find, both domestically and internationally, that this variant is pretty much everywhere. We're only detecting it now. It's been out there for weeks. So there's, nobody's going to, you can't shut down things and prevent this particular variant from seeding some sort of transmission somewhere else.
Thank you so much for your time, Professor Alex van der Heever, speaking to us there about the UK taking action which she said could possibly not be scientifically sound, as in if the variant is in the UK as well, that won't prevent it from spreading there. Professor Alex van der Heever is Chair of Social Security Systems Administration and Management Studies at the University of the Witwatersrand in Johannesburg.